Hello everyone, welcome back to my channel. So today we are going to continue our topic, that is the GERD. In this video we are going to talk about the clinical features of the GERD, which can be esophageal or non-esophageal. Esophageal symptoms can be heartburn, regurgitation, and when a person bends or strains his body, these symptoms increases and the coughing also increases. Next is dysphagia, problem in breathing or problem in swallowing difficulties, and water brush. What is water brush? When the food enters into the stomach, the reflex take place into the esophagus, and in this response to reflex, a lots of saliva is produced and the mouth is full of saliva. Then water brush take place. This is known as water brush. Next is non-esophageal symptoms. Non-esophageal symptoms can be atypical symptoms. What are atypical symptoms? In which we have to differentiate from other diseases. Like we have chest pain. Chest pain can be present in various diseases, but we have to differentiate. And we can differentiate from angina by ECG or taking upon history or examination. Laryngitis, in which these reflux irritate the larynx and inflammation of larynx takes place, which can lead to cough and which can lead to chronic cough. In the night, a person wakes up by choking. Next is recurrent chest infections or pain on swelling, hoarseness of voice or dysphagia. So next is investigation. What we will do investigation to differentiate or to diagnose this disease. We will do investigation depending on the history or presentation of a person. If a person is young and typical presentations are or typical symptoms are present and no alarming symptoms are present, then we will do only PPI and we will send him or her home. If a person is elderly, the age is more than 55 and dysphagia is present, medical treatment is all failed and atypical or alarming symptoms are present. Alarming symptoms are dysphagia plus weight loss or dysphagia with anorexia, dysphagia plus anemia, and the fecal occult blood is positive. Then investigation of choice will be endoscopy. What is fecal occult blood? In which a person is not aware of his bleeding in his or her body. From this also, if the symptoms are unclear, if the diagnosis is unclear and the symptoms are suspicious, we will do 24-hour pH monitoring. We will place a catheter with a sensitive probe inside the body and it will record the daily activity of a person and it will record the pH during arising of the symptoms, and during the 6 to 7% of the time, if the pH is less than 4, then it is a diagnostic symptoms and we will do it before surgery. If due to any condition and if sometimes acidity or alkalinity is distorted due to some medication, we will do impedance testing or we will do manometry. It will measure the pressure and if the pressure, in this case, the lower esophageal sphincter pressure will be decreased. These are the investigation of choice. Now we will do the treatment, and treatment depends, first of all, we do the treatment in any disease, it is lifestyle modification. If a person is doing smoking, we will cessate the smoking. Weight reduction will be applicable to the person, he or she have to reduce his or her weight. And if the head of the bed will be elevated, avoid taking heavy meal during night and taking small meals during one time. Second is medical management, in which we will do pharmacotherapy. The main pharmacotherapy we'll do is PPI. And in the stomach lining or in the wall, we have potassium hydrogen pump. In this case, the PPI will block this pump and avoiding H secretion, which will reduce the acidity and which will lead to the healing of the esophagitis. The main drugs are esomeprazole, omeprazole, lansoprazole. But the main side effects of these drugs is headache or diarrhea. If the response of PPI is good or bad, depending upon we will do the next treatment. Like if the response is good, we will maintain that dose only. If the response is bad, we will do 24-hour pH monitoring. Like we discussed, placing the catheter with a sensitive probe. So we will do 24-hour pH monitoring. If positive, then we will do surgery. That is, in surgery, we will do fundoplication. Fundoplication means taking the fundus and rolling around the esophagus, which will narrow the esophagus and prevent the backflow. If the 24-hour pH monitoring is negative, we will review the diagnostic criteria again and we will add tricyclic antidepressants. We can do antihistaminic also in pharmacotherapy, but we will prescribe less than PPIs. It will block the H2 receptor, that is histaminic receptor on parietal cell, which will also reduce the acidic production up to 70%. The drugs can be cimetidine, ranitidine, and famotidine. But the side effect of cimetidine is gynecomastia. So we will prescribe less and we will prescribe more of PPIs. Third management is surgery. And the indication of surgery can be when the person can't take PPI for a longer time, or there are present severe symptoms, or the person is not responding to any medical management or failed medical management, we will do surgery, that is fundoplication. So these are the symptoms, treatment, investigation. We have discussed already what is GERD, pathophysiology. So in the next video, we'll talk about the complication of GERD. So thank you so much and please subscribe to my channel.